My name is Sophia Strike, and I'm one of the hand and upper extremity surgeons at Johns Hopkins. I see patients with problems of the hand and upper extremity, as well as patients who have tumors, as I have a specialty in orthopedic oncology. Cubital tunnel syndrome is a pinching of the large nerve that goes behind your elbow. So people often think of it as your funny bone nerve. Cubital tunnel syndrome is caused by typically a combination of irritation and compression of the nerve. Many people sleep with their elbows flexed all the way up at night, and actually that traction can cause long-term irritation. So nerve symptoms usually consist of a burning or electrical type pain and may cause numbness or tingling in the hand. Patients may also feel the pain radiating from their elbow down to their hand or up towards their shoulder. Carpal tunnel syndrome involves pinching of a nerve at the level of the wrist, whereas cubital tunnel syndrome is pinching of a nerve at the level of the elbow. And typically carpal tunnel will cause numbness and tingling in the 3 fingers on the thumb side of your hand, whereas cubital tunnel will cause numbness and tingling of the 2 fingers on the small finger side of your hand. Cubital tunnel syndrome can also be diagnosed from clinical examination, although when symptoms are not clear, we may also send patients for nerve conduction studies. The treatment options for cubital tunnel syndrome include nighttime splinting to prevent flexing the elbow all the way up, as well as hand therapy for nerve gliding exercises. Some patients who start to have persistent numbness or weakness in their hand from long-term compression of the nerve may require surgical release of the nerve at the elbow. Often surgery for cubital tunnel syndrome can be performed with anesthesia that numbs up your arm and does not require full general anesthesia. After surgery, most patients will have some soreness in their elbow but can go home the same day. It does take somewhere around 2 to 6 weeks, with usually some hand therapy to help getting motion back for patients to feel like they're getting back to normal. In the long run, mild symptoms should recover fully, whereas severe symptoms may take longer and may not get back to 100%.